This is BLACKtalk episode number 1, The Womb and the Room.
This year, every single day in honor of Black History Month, I will be covering a different Black woman who has been obviously affected by birth-related complications due to the color of their skin and sometimes, sadly, even death. Because the Black maternal mortality rate in the United States for Black women is so significantly higher than any other racial group. In fact, according to the CDC in 2022, 49.5 deaths for every 100,000 live births in Black women, only 19 for white women, and only 16.9 for Hispanics. And the largest contributing factor of this large disparity happens to do with racial contributions. This here is Jasmine Patton, 34 years old, of Chattanooga, Tennessee, and she was well aware of the disproportionately high mortality rates in the U.S. when it comes down to impacting Black women because she was a nurse practitioner. In fact, this was her biggest fear, especially after her problems with infertility and the multiple rounds of IVF. Jasmine had a difficult pregnancy to include extreme morning sickness. She also had shortness of breath and fatigue. And oftentimes she would just cry, reading and hearing about all the stories about Black women and the complications they were having during childbirth. As her due date got closer, her husband, pictured here, also started to realize that she was going in a downward spiral. By her third trimester, she was seeing her doctor on a weekly basis, and she was bringing up her symptoms to her OB, but the OB responded in a very weird way. Her OB responded that this is just all a part of pregnancy. On September 28th of 2023, while at work, she started to have an emergency and she was transported to the hospital by ambulance. Shortly after getting there, she was rushed into a C-section and her daughter, Emery, was born. Unfortunately, she never got to meet or hold her daughter because she started declining herself rapidly after the C-section. Just 2 days after her daughter's birth on September 30th of 2023, Miss Patton passed away. Her cause of death was ruled as liver failure due to the acute fatty liver syndrome that she had during her pregnancy. The symptoms of this syndrome is nausea, vomiting to discomfort, vomiting to fatigue, headaches, migraines, severe discomfort. All of the symptoms that Miss Patton was having that she had expressed to her OB, who simply responded, "Welcome to pregnancy." Mrs. Jasmine Patton was so fearful of the possibilities of her own death during pregnancy, which sadly became true because her OBGYN did not take her symptoms nor her concerns seriously.